Okay, so isang maganda at mapagpalang araw sa ating lahat. So welcome ulit sa part 3 naman ng ating series of interview tungkol sa Usapang Kalusugan. Of course, that's in line with our advocacy sa First Services. Dito sa, kung nakikita niyo yung PubMat sa likod ko, no, yan ang ating Focus Advocacy for this month. So FYI lang po sa mga ngayon pa lang makikinig dito sa aming series of interview. First Services is an advocacy-driven training company. So definitely all advocacy po and trainings we support and provide. Pero of course, isa sa mga topmost priority po namin ay ang kalusugan, lalo na ang kalusugan ng pangangatawan. Kaya yun yung ating focus advocacy this month. And of course, ayan, for this day, someone close to my heart. I mean, talagang we're so blessed, no, na ito yung mga laging pinapadala sa amin na i-interviewin. So our next na i-interviewin is also from the medical field and at the same time sa academe. Di ba? All around. And he is the assistant to the Dean of CEU Manila or Centro Escolar University Manila Nursing Department. So, I have the honor to introduce to you Sir Erljohn Gomez. Palakpakan po natin siya. Welcome, Sir EJ. Sir
Yes,
Erljohn.
yes, thank you, Sir Anthony, for inviting me here. And of course, sa mga manonood at makakapanood nitong video, uh, magandang araw, should I say? And I'm happy to be part of this advocacy.
Thank you very much, Sir EJ. So, let's get started. Okay lang po ba?
Yes, of course, that's
Yan.
fine.
So, my first question is, from your personal standpoint po, sir, no? Uh, what can you say about the COVID situation in our country as of the present?
Well, on my personal standpoint, I think the COVID-19 situation is improving. You can see that there are less people with being afflicted with COVID, and I think the restrictions have now eased, and we now don't wear face mask anymore. So I think those are positive signs that we are slowly getting out of the pandemic.
Okay, thank you very much. Now, a follow-up question with regards to that, Sir EJ, or Sir Erljohn.
Mhm.
Can you say that the situation about the COVID situation is in our country is really about to end? Kasi you mentioned kanina, medyo positive yung trending, no? Pero we really say now na talagang ito ba'y matatapos na o malapit nang matapos?
Siguro yung idea natin kasi about pandemic, we have to look at it in the context that we are making progress out of the many initiatives that we have done. Let's say, for example, the immunization that has been carried out, the rolling out of infection control measures. I think those are now bearing fruits. And we can see that the impact of COVID-19 to patients are now getting more manageable than the previous parts. So if you ask me personally on my personal observations and my perceptions, I think that the COVID-19 situation is actually improving, and slowly we're getting out of the pandemic. I think classes have now resumed on site, and I think there are more and more people who are now aware of what to do and how to prevent COVID-19. So I think with that in mind, we can say that we're slowly getting there out of the pandemic.
Thank you very much, Sir Erjan. Now, with regards to our government, so
Mm-hmm.
you mentioned that we have a positive trending. It's about to,
Yeah.
we're improving constantly. But what else can you suggest to our government or to the medical field so as to continue this improvement in the coming months or in the coming year?
Well, I think what we can look at this is that there are lessons learned. So for the government, I think they can use whatever data, whatever evaluation methods that are available to make sure that whatever learnings we have in the management of the pandemic is utilized. And so I think as they say, the best mode of managing a particular uh, scenario is to prevent it from happening. So prevention will always be better than cure. So if to try to look at that perspective, then maybe more effort should be put into the prevention of diseases, and maybe we can look at the trends. Okay, I think at the present time there's a law that is being should we say developed about coming up with a Center for Disease Prevention and Control here in the Philippines. And I think that's a very good initiative because we really need to identify new strains of viruses that can affect our population. So to sum it up, maybe prevention can actually be more helpful in the management of our diseases.
Thank you, Sir EJ. Thank you very much. And as we always say, an ounce of prevention is
Yes,
better than an
yes,
ounce of cure.
I agree, Sir
And
Anthony.
maganda rin highlight ni Sir EJ, ni Sir Erljohn sa atin na the government can utilize the data. Kasi ngayon, Sir Erljohn, correct me
Yes,
if I'm wrong, before wala tayong available data, nangangapa tayo, no? But this
yes.
time, we have the learnings, the experiences, and the data.
And I think,
Okay.
and I think
Yes, sir.
the researches, I think more and more initiatives are being put into research. And if we have such initiatives, then maybe we can use that initiatives to be our armor in times of needs and in times of catastrophes. So it's now high time that we base our actions on data, on data-driven approaches.
That's right. That's right. So I really agree with that. At the same time, the value of research. So
Yes.
now we know that in this situation, talagang kailangan talaga natin na laging data-driven and research or research-based. So Sir EJ, punta naman ako dun sa part ng academe. Ayan. As a nurse and at the same time as school administrator, how do you or your school specifically prepare your nursing students to the pandemic and post-pandemic that they might, no, post-pandemic situation that they might encounter in the coming years?
Well, I think as a nurse, we are always on the front line of healthcare.
Yes.
I think students in the School of Nursing and even the faculty know the importance of being prepared. So to be prepared means to look at the situation holistically. Then I think we followed memorandum orders. We observed social distancing measures. We also observe various protocols in the conduct of our activities in our classes. So if you would want to replicate that in in a bigger perspective, then we could actually look into compliance and observance of established protocols and procedures so that our students, our faculty, and more so everyone is prepared now that we are on the post-pandemic phase of COVID-19.
Okay. So sa mga nakikinig, I hope no we are all learning from Sir Erljohn. I'm quite sure that you're learning. Sige pa Sir
Yes.
Erljohn,
Anyway,
may
anyway,
dagdag.
to Anthony, maganda itong initiative mo na you also reach out, you also share knowledge, insights, and I think we are both learning from this. So I think ang first services actually is, should I say, one of our nation builders because you're able to provide initiatives that can benefit a lot of people. So good job for that, Sir Anthony.
Thank you very much, sir. And of course, the credit also goes to my team here in First Services. Thank you very much, Sir Erljohn. Now, for our last question, ayan. So sa mga nakikinig, at sa makikinig pa sa mga susunod na araw, part 1 pa lang po to. So may kasunod to. Kaya ito yung last question ko. Sir Erljohn, since community health no is one of the components of nursing. So, at alam natin medyo nagbago yung dynamics na in the community. So, what are the latest or specific na latest or mga bago na program or activities ng ninyo po at saka ng inyong paaralan?
Well, I think at this time we are more focused on health education activities. We need to keep people informed, and I think we need to fight disinformation in terms
Yes.
of health related information. So I think that's one of our key initiatives. And of course, on the part of community health nursing, we always believe that community engagement is very much important. So those who are manning the healthcare program should actually look into partnership approaches so that there are more effective delivery of healthcare services. And I think for example, my research group in CU is actually coming up with a study on digital health literacy among Filipinos, and I think that's one of initiatives that can bring more information accessible and utilized in different parts of the country. And I think that because the respondents, or Anthony, of that research are people from not just from Luzon, but we also included Visayas and Mindanao. So it's actually a good study to benchmark how effective and how informations are being captured and utilized by people.
Thank you very much, Sir Erljohn. And tama po yun na talagang at this time, talagang laganap kasi rin yung, yung
Yes,
disinformation. So
misinformation.
talagang it's very relevant, that kind of initiative. At the same time, I was just surprised na talagang national ang scope. And that's good kasi dapat naman talaga lahat masakop, no, at makonsulta rin, na makonsider lahat.
Yes.
But I would like to highlight yung sinabi ni Sir Erljohn kanina na number one, yung holistic yung approach.
Yes.
So it's a good thing na laging ma-remind tayong lahat. No? Siguro yung ibang mga nursing schools na nakikinig sa atin, mga nursing professors, or mga gusto maging nurse, no? Yan. Or yung mga current nurses, it's a good thing na let's take into mind yung holistic na approach. At the
Yes.
same time, let's utilize technology. No? That's one of the opportunity and insight na nag-reveal sa atin.
Data and information.
Yes. And of course, that's the best way to educate people. Tama po, Sir Erljohn?
Yes, that's correct. That's correct.
So, Sir Erljohn, before we end this part 1, do you have something to say pa sa mga nanonood sa atin?
Well, I hope that everyone is doing their best to contribute to the attainment of our different health goals and programs. And I think on a more personal level, I would like to ask everyone to continue taking care of yourself.
Yes.
In various dimensions. Okay, so as what we have said, we have physical, we have emotional, psychological, and this must be holistic in approach. So I think if we would want a healthy Philippines, we should start from among ourselves. We should take care of ourselves, our families, communities, and then of the society. So thank you, Sir Anthony, for having me on this first round of the interview, and I really enjoyed the experience.
Thank you very much. I'm glad to hear that you're enjoying it.
Yes.
So sa mga nakikinig po, no, so nakita nyo naman, yung mga estudyante ng Centro Escolar University, yung mga parents, your children are in good hands. Yan po. And of course, sa mga senior, ako na po yung nag-promote. Wala ho to sa usapan namin ni Sir Erljohn. Pero ako lang po to, initiative namin sa first na. So yung mga senior high dyan, lalo na yung gusto mag-nursing, CEU is one best school that you can enroll. Okay, so thank you very much, everyone. So abangan nyo yung part 2 nito, and God bless us all.
Okay, thank you, everyone.